Hi, I'm Dr. Fadzil Hamza, a Senior Staff Registrar and also the Operational Lead for Singapore Sport and Exercise Medicine Centre at Singapore General Hospital. The practice of sport and exercise medicine involves preventing, diagnosing and treating sport and exercise-related musculoskeletal injuries and using exercise intervention to prevent and manage a variety of chronic medical conditions, ranging from metabolic conditions like hypertension, diabetes, and obesity, to psychological conditions, and even cancers and many others. Our sport and exercise medicine team strongly promotes and facilitates an active lifestyle in all our patients, whether they are already active or sedentary. For the elite athletes, we help them in the pursuit of excellence, pushing the boundaries of physical performance. For those who are sedentary, we provide them with customized physical activity programs or exercise prescriptions, and we journey with them towards healthier and more physically active lifestyles. The sport and exercise medicine team comprises the sports physicians, sports orthopedic surgeons, sports physiotherapists, sports massage therapists, sports trainers, sports podiatrists, and the sports scientists. For sports scientists, this includes exercise physiologists, sports dietitians, strength and conditioning coaches, sports biomechanists, and sports psychologists. We work closely together to deliver holistic care that aims to bring our patients beyond functional recovery. Our patients include sedentary individuals who wish to embark on a more physically active lifestyle to improve their health, such as for weight management. Individuals with chronic conditions such as obesity, hypertension, hyperlipidemia, diabetes, coronary artery disease, fatty liver, and obstructive sleep apnea who wish to exercise safely and manage their condition better. Recreational athletes or individuals who are engaged in physically active or physically demanding vocations such as military personnel, police officers, firefighters, and performing artists, any of whom who are experiencing nagging musculoskeletal injuries and wish to return to or maintain their physically active lifestyles. Young or amateur competitive athletes who seek to start a sport with the correct techniques. Competitive and elite athletes who require pre-participation screening and assessment as well as injury management so that the athlete recovers and goes on to perform even better than before the injury. Individuals from special populations such as those in the extreme age groups like the children, the elderly, women in pregnancy, as well as those with physical disabilities and special needs, with or even without musculoskeletal sports injuries, and who would like to manage their health and condition better through regular physical activity and exercise. Injury prevention and management form the bulk of our care for our patients. The multidisciplinary team approach ensures that our patients recover quickly, return to sport safely, and perform even better than before the injury. We accurately diagnose the injury in terms of its site and underlying pathology. Our doctors have been through years of rigorous training via a subspecialty training program, either locally and/or overseas. During the consultation, our doctors conduct a thorough clinical examination and are skilled to perform diagnostic outpatient procedures, for example, a bedside ultrasound examination. Together with the sports scientists, we conduct biomechanical assessments such as video gait analysis, where appropriate, to identify the root causes of the injuries so that the recurrences can be prevented. Under the guidance of the sports physiotherapists, our patients undergo intensive rehabilitation that is directed towards the specific injury to enhance healing and restore function to the affected parts. We utilize various electrical modalities for pain relief and to promote tissue healing to complement the manual rehabilitation therapy. We work closely with our sports scientists to return the individual to his pre-injury level of activity or even higher through the correction of the underlying problem, such as via sport-specific strength training and conditioning programs, exercise tests, and performance testing for sports enhancement, and also address other factors such as nutrition and supplementation for performance and psychological health. We conduct pre-participation medical screening and assessment for our elite athletes prior to their competition, and when necessary, we provide them with appropriate advice with regard to the use of performance supplements and therapeutic drugs as part of anti-doping strategies.
Hello, my name is Fen Ru and I'm a senior physiotherapist leading the sports physiotherapy service. Our sports physiotherapy service is involved in the prevention and management of injuries resulting from sports and exercise participation. We help athletes and individuals of all ages and at all levels of ability to restore optimal function to facilitate their return back to sports and activities safely. As a part of Singapore Sports and Exercise Medicine Centre at SGH, our sports physiotherapy service works closely with our sports medicine and orthopedic surgery doctors, as well as other healthcare professionals such as podiatrists and dietitians to assist not just the sporting population, but also general population who would like to adopt an active lifestyle. At SGH, we manage a whole spectrum of musculoskeletal and sports conditions ranging from ACL tears, meniscus injury in the knee, shoulder dislocations, rotator cuff disorders, spinal pain, and ankle sprains, etc. We specialize in both conservative and post-operative rehabilitations in order to help patients attain their goal of returning back to their sports or physical activities. We have a wide variety of equipment that we use as part of our rehabilitation process for our patients. We also have different types of weights and a squat rack that we use for strength and conditioning. We use the running track to better assess and manage our sprinters, soccer players, and pretty much anyone getting back to running or sprinting activities. We monitor our patients by performing outcome measures regularly to ensure that their recovery is on track. We also have a Biodex machine, which we use for isokinetic strength testing that further informs our sports physiotherapist's decision-making process on determining whether a patient is able to return back to their physical activities. We also offer a strength and conditioning specialty sessions for our patients who have undergone shoulder surgery to facilitate their safe return back to their sporting activities.
Our care for our patients extends beyond the hospital walls. Our team of healthcare professionals also serve as members of the national medical team, supporting our national athletes in the various national sports associations, and we provide medical coverage for the various sporting events, both locally and internationally. We also collaborate with many community partners, for example, the Health Promotion Board and Active SG, to develop community programs aimed at public health education, engagement, and empowerment to make physical activity everyone's priority, so that our patients, as they are discharged from our care in hospital, can still receive the appropriate guidance to remain physically active and engaged in regular exercise safely to manage their health better. This is in line with our national thrust of delivering care that is beyond quality to value, beyond the hospital to the community, and beyond healthcare to health, as part of the bigger Healthier SG strategy.